by welcoming you all and thanking you for coming today. This is a really exciting project for me that I've been working on for about a year and a half now, so this is kind of a big deal for me, so thank you for being here. The title of this presentation today is called The Healthy Cellist, Physical Awareness and Injury Prevention in Cello Performance, and I'll be showing some of my points with excerpts from Brahms' Sonata No. 1 in E minor, Opus 38. So you might wonder, why am I so interested in physical awareness and injury prevention in the first place? And the reason is because in the summer of 2011 I started to develop hip pain that I didn't know where it was coming from. It started out really mild. It would show up, sometimes go away, sometimes it was anywhere from really mild to really severe. Sometimes it would make playing uncomfortable, walking, other activities were becoming affected by this hip pain. I went to see a doctor who referred me to a physical therapist, and the very first thing the physical therapist said when she came to my office and I described the problem was, "Do you sit for hours a day in any strange postures?" And immediately I thought, well, yeah, I'm a cellist, of course, hours a day sitting with the cello between my legs. So what she was able to help me do is, through acupressure therapy as well as flexibility and strength training, we were able to rehabilitate the hip injury and get back to full playing without any pain. So the reason why I'm so interested in injury because of that is I want to know how to further prevent injuries in my playing, and then as a teacher I need to be able to guide my students into the best healthy playing habits possible. And then the added benefit is that I can have a lifelong career of cello playing without any debilitating pain, and without the pain getting in the way, I'm able to present the music in the way I want and have the music shine through instead of the injury. In studies done in a book called The Musician's Way, which is kind of a guide for musicians recovering from overuse or misuse injury, they did a study of Midwest professional and student musicians, and they found that 2/3 of the professional orchestral musicians and at least 79% of incoming freshman music students were suffering from some sort of injury related to their playing. And I think that as musicians we don't realize how often these injuries can actually happen. And what else I learned in my studying is that the bigger the instrument and the smaller the player, the more likely you are to become injured as you play. So as sort of a smaller cellist, this is something that is of particular interest to me, and my cello students are smaller, and so I want to be able to help them the most I can. So what causes music-related injury, or cello-related injury in particular? The first broad category is called overuse, and this is using correct movements in your cello playing, but for too long or with too much intensity. The next broad category is called misuse, and this is where you're using movements or postures, techniques that are not correct, that is the movement that's going to injure you. And then the third broad category that is something you might not think of is accidents that are not related to cello playing. So if you get hurt in a skiing accident, or you cut the tip of your finger off while chopping onions and then don't let that injury fully recover, that has the potential to really exacerbate the problems that can arise in cello playing. So it's really important to make sure that those get taken care of before you continue to play. We're going to talk about each of those three categories more specifically now. So overuse affects three general areas of your body. First is the muscles. So when we play the cello, our muscles are what are responsible for moving our joints and our bones back and forth in our bow arms or holding our posture up straight. So we use our muscles all the time as we play. Too many repetitions or too much force causes tears in these muscles. So as we use the muscles, they tear, they build up lactic acid. These are things that cause muscle strain and can lead to overuse injury. Overuse in the tendons happens because the tendons are bands that connect muscles to bone. For example, in our cello playing left hand, we have a muscle down here that's connected to tendons that move our fingers. So these work most efficiently if the tendons are able to be lubricated. They have this lubricating fluid that helps them to glide back and forth between the muscles and the bones that are surrounded by them. The longer we play and the more forceful we play, that fluid breaks down and depletes. When we take a break, it can replenish, but if we play for too long without a break, that fluid is completely depleted. And that causes inflammation and swelling in those tendons. This causes a condition called tendinitis if the tendon is swelling or inflamed, or tenosynovitis if the sheets that the tendons glide through become inflamed. This causes problems like tennis elbow or trigger finger. These are forms of tendinitis and tenosynovitis. Overuse of the nerves. So the nerves are the brain's message system to send out either sensory functions or motor functions to our body. This allows us to feel things like hot and cold or pain, and then to be able to control the muscles that move our joints. So the brain sends out a sensation to the muscle, it's able to then contract and move our joints. So if we are overusing things like our muscles or our tendons, what happens is they get inflamed, like we talked about in the last slide, and then they are compressed in the tiny tunnels of bone that these nerves travel through. So for example, in our wrist, at the bottom between the two fleshy muscles of our hand is a bone tunnel called our carpal tunnel, in which travels the tendons that control the movements of our hands, as well as all the nerves that travel from our neck all the way down to our fingertips. There are 3 main nerves. But if those tendons get inflamed, what can happen is the swelling pinches off those nerves and we lose that sensory and motor function in our hand. This is known as carpal tunnel syndrome, and there are a few other nerve compression syndromes that are just as debilitating to cellists. Misuse is our next broad category, and like we said, this is incorrect postures or excessive tension in the player. And these can cause injuries very similar to overuse, but just from techniques that can be changed in the way that you play. Instead of playing too much, too hard for too long, it's playing with a bent wrist or with slouching posture or collapsing your fingertips. These are things that would cause misuse injuries. It's important, like we said, if you are injured, to first recover from the injury before returning to full playing. The first thing that the Musician's Way recommends doing is seeking expert advice. It's not wise to try to heal all by yourself. There are physicians or even expert teachers, physical therapists. If you'd rather go non-traditional medicine way, there are acupuncturists, chiropractors. These sort of physicians are trained and specialized to help with these very kinds of injuries. In big cities, usually you can find what are called performing arts specialists, and they're particularly specialized to help musicians, dancers, actors in the kinds of physical problems that ail them. The second step is to follow the treatment and rehabilitation schedule, and this is so important. Playing should not be resumed until there's a full range of motion, you've gotten all sensations back to the injured area, and you have endurance enough to support your playing. And any physician that you choose can help you to develop a return to playing schedule and rehabilitation. The last smart point is to modify your playing habits. So if you are injured due to overuse, you can modify how long you play, how much force you use when you play. If it's a misuse injury, this is where the teacher can help you to adjust your posture or your finger placement. But if the playing habits aren't modified, the injuries tend to come back over and over again and compound the more that you continue to play with the injury. So there are 8 points for preventing playing-related injuries, and we're going to talk about each of these specifically. But they are: increase playing time gradually, be creative with repetitive practice, warm up and cool down, take breaks, control stress and anxiety, exercise, And the two most important points are play with balance and release tension. Increasing playing time gradually. If overuse and misuse injuries most often occur in situations where a student is preparing for a recital or an audition, if they're participating in a summer camp that causes them to go from maybe practicing half an hour a day to 4 or 5 or 6 hours a day, this is breeding ground for overuse injuries. So in circumstances like this, it's smart for the musician to be really diligent and dedicated. It takes self-discipline, but if they can have the foresight to predict when they're going to have a stressful playing circumstance come up, they can make a gradual increase in their playing time. This allows your muscles to build endurance and strength and flexibility that will support the body health so that overuse injuries don't occur. The second one is to be creative with repetitive practice. As musicians, what we do is practice over and over and over again, especially tricky passage work. It just needs to be practiced all the time. So instead of doing the same mindless repetition over and over, using the same muscle groups that we use all the time, it's smart to vary things like the rhythm that you're playing or the tempo. You can even switch up from playing something that's technically difficult with a lot of really fast notes to something that's maybe a slower tempo that requires a lot of sustain in the sound. And alternating maybe every 15 or 20 minutes will give those muscle groups time to rebuild their fibers and to lubricate the tendons. We need to warm up and cool down. This is so important. Just like athletes getting ready to play sports, musicians need to warm up to get their bodies ready to play music. This increases the blood flow to our body and our brain also to help us be smarter as we practice, and it also lubricates the tendons and joints so they don't get torn or swollen. All it takes is 10 to 15 minutes of warm-up or cool-down. The musicians may recommend starting with full body motions like arm circles or trunk rotations, maybe forward bends, doing some stretches, maybe running around to get your heart rate up. And then when you get onto the cello, start with slow, quiet playing and gradually increase your playing to more intensity. When it comes to cooling down, maybe 5 to 10 minutes is all you need. And what they recommend is doing those full body motions again, doing some stretching, and then rest. Don't go off and do something physically strenuous, or obviously you're going to increase your likelihood of injury. Warm-up and cool-down is also a good opportunity to make practice goals. During your warm-up session, determine what you want to accomplish in your practice, and then during cool-down, you can evaluate how those goals went, and then revise your goals for the next day. Taking breaks is important as warming up and cooling down. So, just like we talked about, the muscles need time to rebuild, the tendons and joints need time to lubricate, and that's where the breaks come in. There are 3 different types of breaks that musicians can take. The first kind is called an active break, and this is where the musician is still at the instrument. They haven't put it down. Their brain is actively involved in the music, but they're giving their body time to rest. So things that can be accomplished during an active break are figuring out a tricky bowing and fingering, or practicing the rhythm, like I have my students do on a cello drum. They're sitting here, they know what I'm talking about. Or you can listen to a recording of your music with the music in front of you and actually mentally practice. This is a good way to take an active break. The second kind of break is called a diverting break. This gets the cellist out of the practice room, away from the instrument. This is able to clear the cellist's mind, refresh their bodies, give those muscles and tendons time to get ready to play again. During a diverting break, it's smart to maybe use the restroom, go for a walk, eat a snack, maybe call a friend. These are things you can do during a diverting break. And the last kind of break is called a restorative break. This is when your body and your mind are away from the instrument and you're giving yourself time to totally rest. This picture here is an example of in the Alexander technique, which is a technique that helps not just musicians, but actors and dancers, athletes, find body awareness and best posture for ergonomically using your body. So this picture demonstrates what the Alexander technique calls constructive rest. This realigns joints and muscles, says Mr. Alexander, the creator of the Alexander technique, and gives your body time to rejuvenate in a longer break. The ratio of playing time to break time should be about 30 minutes of playing to 5 minutes of break, or if your focus stays better for longer periods of time, you can play for 50 minutes and break for 10. I even read something last night that says if you are playing something really intense and it takes a lot of physical and brain power, you can play for 15 minutes and then break for 2 to 3 minutes even, and that's a smart way to construct your practice and break time. Another important aspect of preventing performance injury is to take control of stress and anxiety. In an article that I read called The Musical Temperament, it said that musicians are, compared to the general public, more likely to develop anxiety and depression. That combined with the stressful circumstances we play in, we're always comparing ourselves to others, we're in competitive environments, there's always somebody out there playing better than you that's going to get the job. You know, these are the kinds of thoughts that we have in our heads that we need to really control, or we're led to playing for too hard, too long, and then we ignore our body's warning signs. So taking control of stress and anxiety is so important. We can do this by participating in things like the Alexander method or the Feldenkrais method. And there are trained teachers and so many resources out there to help us figure out what to do with that. Or we can exercise is a really great way to control stress and anxiety. Even seeing a therapist and talking it out is a great way. Oh, probably the most important for me is to avoid procrastination. If you leave something to the very last moment, it's more likely to stress you out and cause anxiety than anything else. So managing our time well and having a foresight to plan things is one of the best steps in controlling this stress and anxiety. We need to exercise, and often musicians don't think about exercise as part of their playing, but if we want to have our bodies working to the greatest of their capacity, they need to be physically fit and conditioned to perform the tasks that we're requiring for them. In a book called The Musician's Survival Manual, there's a physician and a flute player named Dr. Richard Norris, and he outlines a really good fitness program for musicians. It contains strength training, endurance training, and flexibility training. So strength training supports good posture and builds our endurance. If we want our muscles to be able to last for a long time while we play, we need to have strong muscles to support those. I mean, we don't need to be Arnold Schwarzenegger strong, but we need to have them be in good condition. We need to have endurance training as part of our exercise to make sure that we have good oxygen and blood flow to our bodies. And also, endurance training, an added bonus is that it adds lubrication to our tendons and joints. And flexibility training is important to avoid stretched or torn muscles and tendons, and it prevents tears and tissue damage. So really good exercises that musicians can incorporate into their lives are swimming, Pilates, yoga, and even Tai Chi. All of these exercises get your body moving in the same body muscle categories. What am I trying to say? The same muscle groups that are used to play the cello are exercised in these 4 exercise activities. Now we're to the 2 most important points. This is balance, and this is so important in preventing performance injury. When we sit with balance, the rest of our body is free to move. And you can compare it to a balance